Hey everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about taking caution when creating a telehealth-only practice. I have had a lot of viewers reach out to me stating that they are in the process or are planning to start an only telehealth practice. And while I think that is wonderful and it's great and I'm excited for your new adventure, I do want you to do it with some caution and understanding. I know it's really hard to keep up on all of the changes in healthcare all the time, especially as a provider, especially as someone who maybe is new to the field or maybe never branched out on their own and didn't know that you need to watch certain things and pay attention. But that's why I'm here. Unless you're in behavioral health, which already has established permanent telehealth guidelines that came out recently, you are kind of gambling with your future if you're opening only a telehealth practice. Yes, telehealth has been used very frequently and across all different specialties since the pandemic started, and that's only because Medicare softened, eased up, changed, made telehealth more accessible to more people because they loosened the requirements. Yes, these are going to continue to be the same until the end of 2024, and you're going to say, that's over a year away. I mean, a lot can change by then, and I'm, going to be good to go, and, that gives me a whole year and a month or two to figure out what the next steps are, but time goes really fast. And although we all have good intentions, if they decide not to keep in place or implement permanently the current guidelines, which I don't think they will, they probably will keep some, but not all, then you're going to be scrambling at the last minute to try and adapt and change your practice setup in order to be able to continue having a business and staying afloat. Medicare is keeping their guidelines until the end of 2024, but that doesn't mean the commercial insurances are. I can tell you for a fact that Aetna has already announced starting October 1st, they are going to be changing some of their telehealth coverage and requirements. I did not log into Availity to find out exactly what those are. If you have access to Availity, I encourage you to do so, especially if you're offering telehealth services and to Aetna insured patients. But this is just showing you that they're slowly changing it over back to the way it was. I can already tell you that a lot of them, and this is in a previous video I recently released, that they're starting to go back to reimbursing less for telehealth services. They're not going to reimburse the same amount as they would as if a patient was seen in-house, which makes sense, right? Because you're using less resources, so in their mind it costs you less, so they're reimbursing less. Also, you're not putting your hands directly on the patient, so that's also considered in that as well. They are also going to start putting things towards patient cost shares again. So before, with the pandemic and with certain diagnoses, things that were related to COVID-19, things were not applied to patient cost shares, and so everything was covered. And patients were never really utilizing telehealth that much before the pandemic because it was really hard per the guidelines for practices and providers to offer telehealth services on a regular basis. So patients weren't really used to that service before, and then they got to do it during the pandemic, and they got used to not having to pay for stuff, it being so readily available to them, etc. And now you're going to ask those patients to also try to understand the next wave of changes. And that's not only going to be hard on you as a provider, practice owner, manager, to be able to explain to patients why they're getting a bill for telehealth, or that you can't offer certain services via telehealth, or they have to be in a certain location to receive telehealth, or you have to be in a certain location to receive telehealth, because those were all things that were in place before the pandemic per Medicare guidelines in order to be able to bill for telehealth services. I think they're going to be a little bit looser when they finalize the telehealth guidelines, but I'm still not convinced it's going to be as easy as it has been. And I would hate for providers like you trying to start up a business, continue your livelihood, and putting all your eggs in this basket with assumptions instead of hard facts. So I encourage you, if you're going to do this, maybe still have a day or two in the office where you're putting hands on patients. Have a brick and mortar building. And I know that's more expensive. Trust me, I've helped a lot of people with startups. I know how cumbersome it is. I know how expensive it is. But I just would hate for someone to anticipate and put all your eggs in one place, assuming telehealth is going to continue being widely accepted, able to bill for all these services that you hope to do, and it's not going to be covered. I know that they're doing a lot of talks, and you should pay attention to the MGMA website, the AMA website, and really be involved as this kind of evolves through the process until they make these final decisions. I'm guessing they're probably going to put in their final decisions for telehealth by mid next year at the latest, hopefully, so people can adjust and kind of plan for the beginning of 2025. But again, that doesn't give you a lot of time, and if you're solely only providing telehealth services, and all of a sudden you realize that your model of care, your specialty, whatever, couldn't stay afloat or continue with just offering telehealth services, you're going to be scrambling, it's going to be expensive, it's going to be stressful, and I don't want that to happen to people. So I'm just putting this caution out there for you, something to think about. Obviously, it's your decision, but I am wanting you to make the best informed decision you can for yourself, for your profession, for your family if that's involved, your spouse, your colleagues if someone's going into business with you. I mean, there's just a lot of people that this decision affects if you are doing it with the basis that that's going to be your sole employment, your sole income, etc. If you have any questions or comments about this, I would love to hear from you in the comments below. I'm not trying to be a Debbie Downer. I'm not trying to be negative. I'm just trying to be realistic. And I just feel like I would be doing all of my viewers an injustice if I didn't bring this up, because people get excited. Telehealth is convenient. It's been reimbursed well. It's easy. It gives a low overhead for starting a new practice. And all those things are wonderful. But if they make it difficult to bill out like it used to be, or they put some strict parameters where it can only be maybe every other appointment and those other in-betweens have to be in person, or, you know, the reimbursement they lower even, you know, less than the telehealth is now, then, you know, you'd have to see so many more patients to be able to make ends meet. I mean, there's so many options of where this could go that I just wanted to bring this to your attention. Thank you so much for watching today. If today's video was helpful or informative or whatever in the positive light that it can be, please smash that thumbs up button. Subscribe to my channel if you haven't already, and please share this with everybody whom you know that it would affect that needs to hear this. Have such a wonderful day. Take care of yourself. Bye-bye.